if you take a community care provider's roster and it's got gaps in it, that care worker isn't able to maximize their earning potential. So if we can build a system that directs the care seeker towards the gaps in a roster and fills them, then the time that the care worker is out and engaged with their work, with their employment, they maximize their earning potential. That's brilliant then for retention. It's brilliant then for their quality of life because they've got more money in their pocket. But at the same time, that company is able to serve more customers.
Okay, and you're happy with everything?
Yeah, perfect. Let's go.
Hi, and welcome to the Chasing Care podcast. On today's episode, we're going to try and do a bit of myth busting and look at some of the paradoxes that we have in the home care home sector, community-based care, as people know it. So I'm delighted to say on the program, we have Will Flint. He's a very successful care provider in a local community. He'll tell you all about that. But he's also found a bit of a solution to some of these challenges. So before we get too far down the track, Will, introduce yourself.
Great. Thank you so much. Really great to have this time with you today. So yeah, look, I was on the graduate training scheme for the NHS in 2000. And after that, I spent 12 years in the NHS running large acute hospital services mainly. But then at the very end, when I moved back down to Devon, where I now live, I was actually also running community care services across Exeter and East Devon. So that was both NHS and social care. That was then the point at which my interest in community services was really peaked. And I wanted to have a go at providing a home care service in the community. And I've been doing that now for 12 years. So we provided over 2 million hours of care. I've got about 180, 185 staff in the business, and 3 of the locations are rated outstanding. So you're really proud of the team and the service that we're delivering, and absolutely love community care and everything that offers our customers.
Interesting. You said you'd give it a go. 3
Yes.
outstanding branches sounds to me as if you've sort of got it right. Let's touch on that for a second. What do you
Yeah.
think magic formula is that you've you found in your care?
Do you know, it's really interesting. I think I'm not sure if there's a formula as such, and in a way we've tried to avoid having a formula. We've got processes, obviously, that the regulator wants to see. The key thing for me is about people feeling what I call is chest out proud. So when they walk into Tesco's, Lidl, do they reach to take their badge off to cover their tunic up, or are they quite happy showing that they work, firstly, in the community, and secondly, for us as a provider? The thing that triggered me starting our business was a really bad safeguarding meeting that I was chairing. We had police there, GPs there, nursing teams, and so on. And the provider said to me after that meeting, "It's not possible. You can't provide good care." And I just thought, well, that can't be right. That still drives me 12, 13 years later. I just want to prove that you can, because we have to. We have to. People deserve it.
And you said you came from the NHS. Do you
Yes.
therefore look after a lot of public sector work, or is it a mix of private and public sector work?
Yeah, so it's a mix. We're predominantly focused on the private sector, but then what we do with the local authority, with the NHS, is we focus on really the things that they find difficult to fulfil. So it's overnight care, end of life support. We've often delivered a lot of double-handed care for them as well, because that's challenging. So we really work with them hand in hand. So, okay, well, what are you finding difficult at the moment? At the moment, it's nights and end of life. That's where we then focus our time and resource.
You're down in the southwest. To me,
Yeah,
that feels very rural. No major challenges around finding the care workers for that sort of location.
that has been a constant challenge. I'm not unique in that, providers do find
No.
that challenging, but yeah, we've got a nice mix. We've got Exeter, the city, but then, yeah, you're right. We've got the rural areas around East Devon, especially. Um, the key thing there for me has been about their journey from the minute that they first call us, but importantly then about how we value them. So we've just had in August our annual summer awards. We had about 120, 140 people at that, including, their children, to make it a really fun day. And that's just one of the things that we do to make staff feel valued. And that way then your retention's really good. So the staff that get through induction and their 3-month probation, 94% of them then stay with us 18 months or longer. So, I think it's about how you value them and how you support them.
I was talking about care workers yesterday with a training provider, and it was quite frightening the percentage of people that leave the industry. I mean, it was, I think Skills for Care said it 40 odd percent of people who come into the sector leave the sector.
Yeah.
Is that something you're feeling? Or do you see that? Do you hear that? I mean, what's your view on it?
We look, we work really hard on that, and retain our staff well. As I say, ours is over 90%. However, it wasn't always that way. But we do see it a lot in the sector. I think it's one of the things that would make a massive difference in the sector if we could just crack the conditions in which people work, the way that they feel valued, but also maybe, Gavin, it's about actually recruiting the right people in the first place as well. I think that's also some of the reason for the turnover.
And again, it's another subject. I think I spoke to Jael Alfonso from Network Healthcare, who indicated that they're very careful about who they recruit. And I sort of challenged her to say, isn't there a temptation just to recruit anyone? And that was a flat no. But I get the sense that there are providers out there that will take pretty much anybody if they feel they can make a buck out of it because they're struggling to find staff. Whilst you said you don't have a magic formula, how do you ensure that the people that you're recruiting are going to stay? I mean, 90% is amazing, Will, a fantastic retention rate. I mean, what do we do because if we could emulate that across the whole sector, we wouldn't have 152,000 vacancies, would we?
No, I think it starts from, the advert communicating. You've got to communicate accurately what you do, so that the expectations are met from the beginning. I think it's got to be aspirational, but then you've also got to live up to that aspiration when they're actually in your team. And I think it's then also that word team is really important. If you're part of a team, you talk to each other, you support each other, you value each other, you want to train and get the best out of each other. You allow people to give you feedback as well, dare I say it. Those are some of our key building block. When we first started the business, Sarah, my wife and I, and we sat down and we wrote down what some of the key things are that we wanted to achieve, to offer. And one of them was meaningful employment. Now, it's not a very catchy phrase, but we all spend so much time at work. Our work has to have meaning. And sometimes as well, you have to communicate that meaning. And it's really important that we do that.
Somebody mentioned about work-life balance, and I would argue that it's life-work balance. And care workers are often demanded upon excessively. And because of their compassion, they tend to do it until they've had enough. They just burn out eventually, don't they? But it sounds to me as if you've got some formula, although you say you don't have one, but it does sound as if you have one, Will, that makes them feel as if they're valued. I think
Yeah.
if you talk, some people out there, I think Visiting Angels, they talk about carer centric. They say it's innovative. My argument
Yeah.
is that it's been around for years by good quality providers.
Yeah. I think, I respect what they're saying. I think it's sad in some respects, though, that we say that valuing our team is innovative. And I mean that respectfully. I think that just should be the bottom line. I mean, think what these are doing, something really unique and special. If you think about what our night team are doing, they might be at 3:00 in the morning in a customer's home. They're at the end of their life. They've got a distraught family there with them as well. That's very demanding and very challenging. It's also challenging after the event. That customer might die whilst they're there. And how do we support that care worker through that? And I always make a point, for example, if I know that's happened, I'll contact the care worker myself, care worker of the month, their birthdays and so on. They get a personal message from me or from the team. And I think building that sense of team, that shared goal, we're here to make life outstanding for people living at home. It's not just a job. And going back to what you're saying about that life and work balance, I think our team feel that what they do is part of their life. But it doesn't mean that we can call them all hours, constantly asking them to pick up shifts and all of that kind of stuff. That's bad practice. And that does mean that people will leave. So we're just very careful both about highlighting when they've done a great job, but then also just protecting their time when they are at home with their families.
Yeah. And I wasn't actually going to touch on this point with you today, but because of the way the conversation's going, I feel compelled to ask a question, which came out of this podcast that I recorded yesterday with a training company. And I was asking whether or not the trainers felt that care workers were looking for a career or saw the industry as a career. How do you balance that out? Because I think there's a huge perception again in the market that they're low skilled, low paid, low valued. You pick a low, and the media will give them that label. But what do you
Right.
feel
Yeah.
in terms of being able to give somebody a career in the industry? And do you feel that the people that you talk to want a career?
I think it, it's really, it's dangerous to assume that you know the answer to that as the employer. So, assume that because they're in the care sector, they don't want a career. It's not true. And it's surprising when we put a message out to our team saying, who wants to get involved in some development to become a care mentor, for example, you know, a lot of hands will shoot up. And that's a really useful exercise to then identify those people that do want to progress and develop. Now, one of the problems in the care sector is there isn't, it, it's a very wide base and then it gets very narrow very quickly.
Yeah.
And there's only one registered manager. There's often only one coordinator. There might be 2 or 3 supervisors in a business, but there might be 50 or 60 care workers. But there are things that you can do, as I say, a care mentor, get them involved with training. We have members of our team who will look after our customers on days out and put events on. It's about getting under the bonnet with your team, finding out what it interests them, what floats their boat. Dementia, give them specialist training around that, and then build a round of care around their interests, their training. So, you know, as I say, that it's then thinking about a career in a different sense, because as I say, there aren't many opportunities to go up necessarily, but there are to diversify and to gain new skills. And that's what we find our team love, is that opportunity to add strings to their bow intellectually and professionally develop them. And I think that's where the career aspect definitely comes in for them.
Can make the assumption, because we do it internally, you spend time, the operations team spend time caring about the carers, speaking to them and not just saying, I've got a shift. There's a different
Yes.
attitude, isn't there?
Yes. Yeah, definitely. I mean, again, something I think of very often, it still impacts me today, is when we first started the business and care worker came into the office. We've got a kind of a common area with a coffee making, and I made them a coffee whilst I was making my own. And she commented to the trainer after, she said, my God, the previous owner of the company would never have done that. The only ever time I heard was if I'd done something wrong or if they needed a shift
Yeah.
covering.
Yeah,
I just don't think that's the way to grow a business. It's a people business, isn't it? So
absolutely.
let's give each other that respect, but also just treat each other like people.
And do you think that in some way provides a better service to what we call the service user, but what I should really call the needy, vulnerable person in the community? Do you think that makes a significant difference, a small difference, any difference to the way that care is delivered to someone?
It might be intangible, but I think absolutely yes, like 100%. We've probably all had it. You go to work and I don't know, your computer's still not fixed, or you've asked for a new office chair and it's still not the right one, and your back hurts at the end of each day. You just don't feel good, do you? You don't feel looked after. If you pay personal attention to your team and treat them like a team, then absolutely they go in feeling positive. They've just had a great call with their supervisor who's spontaneously called them and said, you did a great job at Mrs. X, the family have just called us. You go in with a skip in your step. Absolutely. I think that kind of positive feedback is really good. Another thing that I do as well with my team is so we've got those outstanding rated businesses. I say, you have free reign to ask anyone in the business, me, right through to, the training manager, whoever, was that outstanding? And, again, having that open culture, I think also promotes, because then if they see something from someone else's practice in the previous visit that wasn't quite up to scratch, it's no blame, just was that outstanding? No, it wasn't outstanding. This is how we could do it better. So just promoting that culture where you're allowed to challenge each other, I think is really important.
And I'm assuming, therefore, that you allow your customer to challenge your business as well.
Oh no, they just have to be quiet and let us deliver whatever we want. No, absolutely. Please don't quote me on that one. Don't make that
I was just
the
reading an
snippet. No.
article the other day about Gerald Ratner. You might remember Ratner's Jewelry,
Yes. Oh
who
gosh.
grew to
Yes.
200 odd or 2,000 odd stores and then said, our product
Yes.
is crap.
Yeah.
And then the business collapsed.
Publicly.
Yes, I
Yes. I
know.
mean,
So
it was
Will,
overnight, wasn't
hopefully
it?
I'm not going to destroy your business today.
No, no. No, look, well, what I can, we've just done our customer survey, had some really great responses,
Lovely.
but there's a lot in there that, yeah, you're right, we can do better. But it's interesting. Every year, it's always down to communication
Mm,
and how can we do that better? I remember in my NHS days, someone coming to speak to us about leadership and so on. They said, if you think you've told someone or engaged with someone enough, do it 3 more times and
mm.
then do it another 3 times. You can't communicate enough, can you? And that's
No,
what, our customers, our service users want.
but then again, you have to communicate in an effective way. Listening to what
Yes.
you said about the NHS, unfortunately, I feel they might be saying the same thing over and over again and not getting a different result. Definition of
Yes.
insanity.
Yeah. Well, it does. It makes you insane and it drives other people insane that are on the receiving end of it, I think.
Yeah,
Yeah,
I think absolutely
absolutely.
right. Let's talk a bit about myth busting, shall we? And
Yeah.
I know you're a bit of an advocate on the idea of breaking down what people perceive are challenges, problems, issues in the care sector. And to be fair, my podcast, Chasing Care podcast, doesn't talk to the chief executive of the Home Care Association or these bodies that are trade bodies for what we do in the sector, because they just come up with a bland statement that
Right.
everybody should have a minimum wage and
Mm,
it's the government's fault and it's the local
mm,
authorities' fault and we're working hard to fix it, but they're not listening.
right.
I like the grassroots, honest sort of approach to this. And we've touched on it. We are challenged, I think is the word, to find enough care workers. But the way I look at it, and I've always looked at it, is that Network Healthcare, well, our sponsors of the show, they don't try and fix the problem nationally, even though they have many offices. And I'm
Right.
guessing that's how you see it, that you're trying to fix a local problem when it comes to the challenge around care workers. Would that be a fair reflection of what you do?
Yeah, absolutely. I think we do, 2 things there. It absolutely is local. It's down to supporting an individual provider to maximize the resource that they've got. That could be a care home bed, or it could be an hourly care team of care assistants. It costs a lot of money to build that resource, physically, the care home or the team of care workers. How do we maximize their potential to provide care? And yeah, for me, that happens, very much just one service at a time. And that then becomes transformational when it begins to spread. But it's transformational on an individual level.
What do you mean by that? Transformational on an individual level. What do you mean?
Yeah. So if you take a community care provider's roster and it's got gaps in it, that care worker isn't able to maximize their earning potential. So if we can build a system that directs the care seeker towards the gaps in a roster and fills them, then the time that the care worker is out and engaged with their work, with their employment, they maximize their earning potential. That's brilliant then for retention. It's brilliant then for their quality of life because they've got more money in their pocket. But at the same time, that company is able to serve more customers, more clients, which then knocks on to get people out of hospital. So it can start right down at just filling the gaps in a roster, benefiting the individual. Ultimately, that leads to people coming out of hospital and unclogging our NHS system.
Oh, right. So we're getting a little bit close to your part-time job.
Yes.
So let's touch on that a bit further because we've got the challenge of care workers. You've just mentioned the challenge of a care worker maybe not being maxed out in terms of earning potential, but also the provider not making the maximum return on their investment into that care worker.
Sure.
So from my side, I always hear people don't have enough care workers. So that means that they must have enough work. There's a bit of a paradox in itself. I do know that there's a 24% lag in discharges from hospitals because there's capacity issues. So that sort of marries into what I've just said. So there is no capacity. We've talked about increased demand in the public sector of about 9%. Yeah, you feel as if you've got something that you can do to help all of this mishmash. So let's step forward now
Yeah.
and say, right, okay, Will, what did you see? What are you doing about it? I'm just jumping into this episode, which I hope you're enjoying, to ask for a favour. It's really important to us to get likes, shares, following, and comments about the Chasing Care podcast in order to build the audience. So if you know anybody that's in the care sector or thinking about care for a family member, maybe you could like, recommend, and share. Let's get back to the episode.
Yeah. Okay. Well, so as an NHS manager, I won't say which hospital, but there's one hospital that I remember in particular being on call, especially, well, it didn't matter whether it was a weekday or a weekend, had a very long corridor. I would come home with blisters. Now, the reason I'd come home with blisters is because I was pushing patients up and down a quarter-mile long corridor because there was nowhere for these patients to go. So we were outlying medical patients into surgical wards and so on. And then when I was working in the community health and social care manager, um, I would have a bank of staff that were constantly calling around providers, asking the question, have you got capacity? Could you take on Mrs. Jones? Then as a provider, so for example, already this week, I've had 49 individual requests for us to deliver care in our area from the local authority. And it's wildly inefficient. So you're saying, what have I seen? Well, I've seen that there is a lack of visibility of care capacity in the market. Now, if you are able to show your discharge teams, your social workers, the private individual, what provision is available, it transforms the way in which they are able to, speed up their journey, prevent admission, support discharge. And it's really important that with just that one tool of giving people access to real-time, live, bookable care capacity can transform their journey. Our very first person that used Pearly was on the northern coast of Somerset. They'd been looking for a care provider with a social worker for 103 days. And the reason they'd been without support all that time was simply they couldn't find a provider. With Pearly, they put their care request up on the system and they found they had 2 replies within 2 hours. And they're now being supported by that individual happily and able to remain in their home. Another one, in the 3rd week of running Pearly, they'd been in hospital for 52 days. On the 53rd day, we spoke with a social worker, introduced them to Pearly, and by the end of the following day, they'd got 6 offers from different providers to meet that individual's care needs. They'd been in hospital. If you take the excess bed days on that, it's nearly £19,000 in excess bed days just on that one individual because they couldn't find a provider. They were fit for discharge, Gavin.
Mm.
And so that, what have you seen? Well, it's the fact that you can't see what providers could actually do. And so we've created a really simple platform, pairly.com, pairly.com. Go onto there and just enter 4 simple pieces of data about yourself. So who needs care? Whereabouts do you need care? What type of care? And what age are they or you? And it will show you all of the providers, both care homes and home care, that are available in that postcode area with live bookable care capacity.
Let's backtrack a little bit in thought process because we've got two sides to every coin. We've got the
Mm,
providers that are sitting there saying, I could do it. And you've got the discharge team thinking, well, I normally go to this provider and I go to that provider. There are frameworks, there are agreements, there are contracts in place with often with hospitals and local authorities, which are quite rigid on occasions. Has that really held back this vision, if you like, that you've put on the table? Because whilst you might say that 6 people offered, can the hospital or the local authority actually use these providers because they don't fit within the standard frameworks? I mean, how does that all work?
Sure. So that's not a problem. Pelly, we don't mind how your care is funded. Now, if you are funded by the local authority, or if that capacity is only available to the local authority, you can select a toggle, turn it on and off, and make it available to the whole market or just to the local authority. So there are really simple ways that you can help direct those discharge teams, those social workers, to the kind of care provision that works for you. Now, even if you go to the extent to a further extreme on that argument, um, what Pearly does is it will, so Somerset's County Council's feedback to us is it takes them at least 5 hours to find a provider, 5 working hours. However, using Pearly, it takes them less than 2 minutes. So if nothing else, there is a massive time saving here, and time is resource that can be allocated to other tasks, to other people that need it. So whilst there is, like you say, this increase in people needing support, Pearly enables that social worker to find more providers more quickly, and then filter them as to whether they're on the framework or not. Um, you know that can be facilitated with ease.
I have to obviously, I'm going to challenge it again, if I may. I feel as if
Go
I'm a
ahead.
bit like a Newsnight presenter, and it's not having a go at Pearly as a platform,
Sure.
because it's going to open up the eyes of somebody that's trying to find a provider. But from your experience since you started Pearly,
Yeah.
how available, or how can the NHS hospital go to somebody who's offering their services that are not on the framework? Because if you can have 20, 30 providers saying, yes, I'll do it. But if none of those are the people that are on the framework,
Yeah.
where do we go next? How does that work? What's your next
Yeah.
level of solution, Will?
Yeah. Yeah. So the next level of solution is that we as care providers, especially community care providers, our capacity is constantly changing. We've got customers coming and going all the time. Now, we estimate, and we've worked with other providers, between 6 and 9% of their customer base will turn over every month. So there is constantly that churn of 6 to 8%, as well as the gaps in their roster, as well as the new staff that they're appointing. So there are almost 3 pieces of the pie that you can go at. So let's say you enter a care request in, there isn't anyone immediately available on that framework. What Pearly will then do is it will put a pin in that customer, locate them on a map, and the care provider, when they have a customer sadly die or go into hospital, it will immediately show them customers that match that availability. And maybe they have been sitting on Pearly for a day or two. That does happen. That is a
Mm.
reality. But the key thing is about the efficiency that we operate with, and that tool that we give the discharge team or the social worker to log a request, but can then be filtered as a provider. Otherwise, I get a WhatsApp, I get a phone call, or I, worst case, get a PDF document. Now, you can't filter it. You can't find the postcodes easily. It doesn't matter the availability that you've got. Whereas Pearly will show you those care requests that do match your availability. When you've gone from having no capacity, you then enter your capacity, and it will show you that list of people who are still outstanding that care and support. So we will be able to get people off that outsource list onto framework providers much more effectively and efficiently.
Okay. Private sector. We've talked about hospitals.
Yeah.
It's a no-brainer. I get that. Private sector. I know of people that have looked for care for their loved one.
Yeah.
Have to admit that more often end of life, and they really do struggle to find a care provider.
Sure.
Is Pearly open to the private sector client that's searching for a provider? Because a lot of them don't actually want to go to these websites that are the introduction agencies, and there's a number of them. Bit of a bugbear for me. I
Right.
don't feel comfortable. It's a personal opinion that an agency introduces a care worker, but they don't manage that care worker. They're not
Yeah.
supporting the family. Some people might want it, but I think many don't. But there's a bit of a marketing thing going on here, which I don't feel totally comfortable with. Pearly, how does that differ in terms
Yeah.
of how that service is delivered to the private sector client that is often going through a very emotional struggle?
Yeah, look, Ipsos surveyed a few thousand people that had had the experience of looking for care, and more than 40% of them described it as distressing. And when they got down to the bones of that, part of that is actually because they don't know what they're looking for. They've never had to do it before, and because it is a crisis situation, and that's really challenging. And so we've wanted to make it as simple as possible and remove any suspicion as well. I think the introduction agency one is complicated because you've got to essentially you're paying an employee. They become your employee. You're suspicious about how much and who is paying the agency. You can enter full pieces of information about that individual that's looking for care. You can do it from your mobile phone or a laptop, and you then engage directly with the care provider. There's no fees to the care seeker, and there's simply a low subscription fee to the provider when it comes to their private listing. But it's a real challenge. I think we've got to help the sector in a way wean themselves off some of these tools because I don't know that the care seeker really enjoys engaging with them. And one thing that we want to do is simply just to be that bridge. We want to enable people to connect with care, to connect with care providers. And so we don't get involved in any more of the process than just saying, right, you need care here. These are the people that can do it because they've got live availability. And again, I think one of the things that really inspired me is that there are some, very good directories out there. As directories go, they're very sophisticated, but they are ultimately just a list. And you still have to call through a number of providers before you find one that's got availability. That whole conversation really only has purpose if you're talking with a provider that has availability that can meet your need. And so I think for us, for Pearly, that's what we've really focused on is availability and making that visible.
Point well made. Thank you for that. One of the big challenges, however, is that most of the care is delivered by the private sector, thousands of different providers across the UK who won't be on Pearly, whereas you have somebody, and I won't mention the brand, but there's a big brand that does introduction that's just had another £20 million invested by venture capitalists in Switzerland because they see it as a technology platform that is going to make revenue. Now, rightly or
Right.
wrongly, but they've got the clout. Your service is commendable, without doubt, but how do we get the message out? By the way, I'm not getting paid for this. When I say how do
Yeah.
we, what I meant to say was,
Yeah.
how do you, Pearly,
Yeah.
get the message
Yeah.
out to the thousands of individuals that are running private care services that could benefit from this and a number of levels, and also supporting more fairly, more openly the needy, vulnerable in our community. I mean, what's your vision on, without giving away this trade secrets, obviously, but what's the vision as to how this can
Yeah.
happen?
So you're right. It's a Penny's like being a small provider, but just on a national scale. In that, if I don't have care workers, I can't meet my customers' needs. Similarly, if Pearly doesn't have providers on, we can't meet the needs of care seekers coming on. And so, and there is often, you're kind of constantly going from imbalance from one to the other. So the way that we've addressed it is we've got started with large national brands. So we've got a number of the largest national brands in the UK on Pearly and using Pearly. That straight away gives us a really strong kind of peppering of availability across the country. But then we're also working regionally with local authorities because we've got some other tools. So I won't give too many of our tricks away, but we've got other tools that local authorities, that discharge teams can use to give them that live real-time insight into what capacity there is in their marketplace. Now, if the local authorities, so some of the ones we're working with, they want to use Pearly as the main tool that they use to find care. Because
Mm.
as we said with Somerset, they've gone from at least 5 hours to find care for one person to under, 2-3 minutes. So we can offer them massive efficiencies. So if a local authority or a hospital is using it, that will naturally attract providers onto the system. That's the way that we're going at the moment. And then if we need to, I mean, we haven't spent a penny on Google yet, you'll be pleased to know. We're not lining their pockets. If we need to in the future, then we might well do that. But it's massively competitive. And I think that the proof of Paddy will come out through its usability. So I've been a social care manager trying to find care in the sector. I've pushed patients up and down the beds in the hospitals because there's nowhere for them to go. But I've also been a provider with capacity and no shop window for it. And so when you merge and meld those together, hopefully you create a really good product, and the proof will be, in the pudding. And hopefully you might have me back in a year's time and I'll be able to tell you how well it's going. But, so far, we've just in Somerset, we've put over £3 million worth of care through. And that without, that's a soft launch. So over £3 million, more than 60,000 hours of care through in one county on a soft launch. So the proof is in people's using it and feeling that they're getting value from it.
It sounds like a no-brainer in some ways to me, that it would be totally logical to have a real-time view as to what capacity is available in any marketplace at any time.
Yeah.
It just makes total
Yeah.
sense to me. So well done for thinking about it before I did.
No, thank you. But don't you think they're Gavin, I know they have some very sophisticated systems for this, but if little know how many tins of beans they've got on the shelf,
Yeah.
why can't we as providers, and that the consumer wants that, why can't we as a provider tell our care seeker how much capacity we've got? Because at some point, and this is for me, this is really interesting, at some point, we have to make a decision around, have we got capacity to deliver care to that customer? And right now, that decision happens after we've had the inquiry. So why don't we move that decision making, bring it forward to the beginning of the week, log all of our capacity before we've even had an inquiry, make it visible, and then people come and pick it off the shelf,
Mm.
so to speak. That we've found in our business takes a load of heat out of the rostering as well. You're not getting a care inquiry comes in, sudden panic, can we meet that care request or not? It's like, well,
Mm.
yeah, it's there on Pearly. They've requested time that we've put up there, made available. Brilliant. Rostering's easy because it's for care that I know I've got. Makes a huge difference.
Yeah. I've had people on the program talking about wearable tech. I hear a
Sure.
lot about people talking about tech. Even the CQC talk about tech. Do you see that the CQC might be saying to everyone eventually, you need Pearly as a solution?
I mean, that would be lovely. And I think what we're really focused on right now is, as I said earlier, kind of slightly tongue in cheek, rather than lining Google's pocket, we want to make Pearly the best product, to make it user friendly, whether that's the provider or the care seeker. And out of that will come some really fantastic case studies that, yes, we can then start to talk to CQC about, talk to local authorities, to NHS England, to the Welsh, Health Board and so on and so forth. Absolutely. Pearly is something that is applicable nationally. It's scaled in order to do that. And yeah, I mean, I'd love to see that. I had the experience of trying to find care for my dad during COVID. I wish Pearly had existed then, because it was, I nearly swore then, it was rather stressful trying to look after dad and
Yeah.
find care at the same time. Some of these things, again, it's okay to invest a lot of money into a tech solution. And I think it has to be a solution, though, not a tech product.
Mm.
Because often what I see happening is people come up with a product and they try and apply it to a sector. Whereas what we're trying to do, and I'm sure many others are, is we've seen a problem, identified a solution that is fulfilled by tech. The key word there being solution. And if it solves a problem, people will use it.
Fascinating. It's been an amazing conversation. I'll just bring you back to one point with Pearly. keep focusing local, fix that local problem rather than worrying too much. This is Dad's advice to you, rather than trying
Yes.
to fix the whole of the
Yeah.
NHS and government problems in terms of health and
Yes.
social care, because you may never fix that. But in
No.
terms of winning the fights in local communities, it sounds to me as if you've got a great idea which is motoring along nicely. And I look forward to finding out more about how you progress that. And have you won any awards yet, Will?
Haven't won any awards yet, but I'm a finalist in the Rising Star award category for the Langbuisson event on the 16th of November. So fingers crossed for that.
Well, I hope it goes well for you. And if anyone was interested in finding out more about Pearly and what that could do for their business, or as an
Sure.
individual that's looking for some guidance on how do I find care, how do they find you?
Yeah. Great. Thank you for that opportunity. So you can email me, Will, WILL, at pairly.com, PAIRLY.com, or go to www.pairly.com.
Perfect. It's been a
Thank
pleasure.
you.
And I look forward to speaking to you in, let's say, another 12 months' time to find out how the journey's progressed.
Excellent. I'd love that. Thank you so much.
All right. Good to speak to you. Take care now. Goodbye.
Thank you.